welcome to the Health Information Management Information Session. My name is Suzanne Adams. I'm the Program Director for Ashton College, and I'll be your host today. I'm joined by Kyla Reimer, who is one of our excellent instructors that we have for the HIM program. And today we're going to explore some of the most frequently asked questions about the field of HIM. So let's get started. Good morning, Kyla. How are you? How are you this morning?
Good morning. I am wonderful. Thanks for having me today.
We're happy to have you. Can you tell us a bit about your experiences as within health information management?
Yes, you bet. So I took the 2-year diploma program in Regina, Saskatchewan at SciAst Wascana campus right after I graduated from high school. That was back in 2005. After my 2-year diploma course, throughout it, I received some scholarships that helped me get to the end of the program. And then I wrote my certification exam with CHIMA, the Canadian Health Information Management Association. And then I started working with the Saskatchewan Health Authority, formerly known as the Cypress Health Region. And I am still currently employed with them. So I have been an employee now with the SHA for over 17 years, as well as I started teaching here at Ashton almost a year ago. And I also recently obtained a position working directly with CHIMA as a community facilitator for terminology standards and interoperability. So throughout my 17 years with the SHA, I have worked the traditional HIM roles in acute care. I've also worked in public health and population health, as well as mental health, long-term care, and numerous different rural sites as well.
All right, so now that we know about more of your expertise, can you explain a bit more what health information management is?
Oh, great question. I love answering this question and promoting our profession. So, health information management professionals or health information practitioners are also called HIMs or HIMPs. You'll hear us referred to as HIMs or HIMPs. Our main role is protecting health information, guarding data from privacy breaches and unauthorized access. We ensure the proper flow of patient information to those who need it when they need it in a timely fashion. We're involved in the creation of the chart right from when a new patient comes into the facility and is registered to when they are discharged after their stay or their visit. And then years later, when it's met the destruction period, we go through the retention and destruction policies and procedures for that. HIMs also do release of information. We perform quantitative analysis as well as quality assurance on all patient data. A more traditional role of the HIMs is the coding process, and this is something that happens in acute care. We're starting to see it roll out more throughout other avenues of our professional roles as well. And it's used for billing purposes. It's used for data collection, statistics. It's a fundamental process in the healthcare facilities, and it helps with the government funding when we know what types of procedures and what types of diagnosis are done in certain facilities and can help with funding from there as well.
It's not a small role
No,
by
it isn't.
any stretch of the imagination, which brings in one of our first questions within the chat is, and you've kind of answered with your answer as well, why HIM is important in healthcare.
So HIMs are a vital role in the whole health information world, in the whole acute care world, as well as we're really seeing a lot of HIMs stepping outside of acute care. And as I mentioned, with my past experience going into some of these non-traditional settings as well, we have an important role and ability to help enhance the patient care by helping into the decision-making process in a variety of ways by performing data collection, analysis, research, as well as we have a large role in project management in a variety of areas within the healthcare system as well. We have a strong background in database management, electronic health records, as well as different software applications. With data analysis being one of our main areas of expertise, we're able to help spot health trends by addressing evidence-based health concerns and work with other healthcare professionals to improve the quality of care for patients and help allocate those resources as well. So HIMs really have a clear picture of the whole process of health information I'm sure we have all had a personal experience, at least one in the healthcare system, and we know what it's like to come in and start that the procedure, whatever you may be having done, even if it's something as simple as lab work, and then right up to the end of that, where you don't even probably realize what happens with your information from there, but to safeguard that information and make sure it's where it needs to be for those that need to pull out that lab work and do the follow-up care.
Right. And this isn't just a provincial thing. This is across Canada.
That's right. Yeah. I mean, really, it's across the world. We have different organizations for depending on the country. So here in Canada, we all follow the Canadian Health Information Management Association. In the US, they have the American Health Information Management Association. So we follow legislation that's not only provincial, but also national standards as well.
Okay, wonderful. Another question that someone has, um, if what skills they need to succeed in being an HIM.
So excellent computer skills is a very valuable resource, especially now in the world that we live in. Technology is ever changing. It's growing. It's fast paced. So you want to have a real good base of computer knowledge, proficiency in information technology, exceptional communication skills. Of course, great organizational abilities, attention to detail. We're doing a lot of analysis, time management skills. Sometimes we're working under some tight timelines. That's another key factor. Again, the eye for analytics, and then the understanding of healthcare law and ethics. As you go through the course, you will gain that knowledge and have a firm understanding. And it does vary a little bit province to province, but we're all under the legislation provincially as well as nationally as well. And then, of course, being a team player, as with any role in healthcare, you want to be a team player. We work with quite a few different teams and departments, so we want to be able to work with them to the best of our abilities and have that open line of communication with other areas as well.
Great. Okay. So if someone wants to start a career in HIM, where do they need to start from? Do they need to start? Can they just take the HIM, or do they need to have a starting point before that?
They can just start our diploma program. After having a high school diploma, you can enter directly into the Health Information Management Diploma program. Once you complete the 2-year diploma course, then you will need to take your certification exam, which is through CHIMA. And you do need that to work in Canada to be certified with our Canadian Health Information Management Association. So that is a certification exam. There's a few times throughout the year that you are able to write that. And then once you are certified, you are free to go to any of the settings that I talked about, whether it's a traditional or a non-traditional setting.
What future trends are we seeing in HIM?
So HIMs it'll always be a top priority for ensuring accuracy, privacy, and security. But we're also continuing to see more and more electronic health records. Healthcare is another, or AI, sorry, and healthcare is another upcoming technology, artificial intelligence. HIMs certainly are a key component to promoting the interoperability of the different electronic health records and different types of databases and systems that are used across the board in healthcare. So the demands for HIMs has continued to grow as healthcare is ever evolving. Systems are always changing, always updating, and HIMs can help pave the way for more efficient, data-driven care.
Great. One question that we have that based off of your previous answer, I'm going to tweak it just a little bit. You talked about artificial intelligence, AI. How does AI affect or impact patient privacy and security?
Well, it adds a new component for, software applications and making sure those barriers are still in place to keep the information confidential and safeguard all patient information regardless of AI technology or not. And it's an exciting new avenue that healthcare has gone into, and we're seeing, increase in turnaround time and more efficient results, even in terms of transcription and how fast reports can be pulled out of the system when we have that technology to help us out with that as well.
Okay, one other question that has come in for us, Kyla. Someone wants to know more about distance learning at Ashton in taking the HIM program?
Okay, great question. This program and here at Ashton College, we offer so much flexibility that it makes it easy for those that are working or trying to balance, the family life work. I get it. I am a busy mom of two and a wife. I get what it's like to try to juggle and balance it all. And here at Ashton College, you can sign up for this 2-year diploma program from anywhere in Canada. In fact, I have had students from all over, and you take your one course at a time, and we go module to module throughout the 5 weekdays. We have 3 live classes and 2 pre-recorded classes that you can watch whenever you are able to, 24/7. We have the unique delivery method of the synchronous and asynchronous classes. So even if you aren't able to attend a live lecture, it is all recorded and you can watch any of the recordings within 7 days of the class. Again, that's 24/7. You can log on to our Google Classroom and view those. So we offer a lot of flexibility to accommodate the students that, like I said, are trying to find that balance with work. We do 20 different modules throughout the HIM diploma program. Within the 2 years, they range from software application, database training to ethics, anatomy and physiology, as well as pathophysiology. We talk about release of information, data, record, and privacy management is another key component throughout this diploma program as well. And then after the 2 years, students will feel confident to write that national certification exam. Before they write the exam, they end our 2-year diploma program with a practicum that is 200 hours. And this really provides them with the hands-on educational component to really utilize all their skills they have learned with us in the 2 years to apply that knowledge before going into writing the national certification exam and then going out into the working world. My personal goal as an instructor here at Ashton, which I'm sure is the same as our other instructors here in the faculty, is to provide a sense of community and support to the students. I want to help them achieve their career goals and succeed academically while really finding that family and work life balance. I offer a lot of flexibility to my students nowadays with technology. We're just a quick email away. So we do have a lot of support systems in place to help our students achieve. And we here at Ashton offer such a flexible learning journey with this unique delivery method that it really is beneficial for anybody looking to further their education.
It is, absolutely. And where the practicums are concerned, this is a win-win situation for the students and for the hosts, because the students are getting that opportunity to take all the theory that they've learned and put this into practice. And for hosts, they're getting that different ideas, a new set of eyes.
That's
They'll
right. And it is actually part of our CHIMA requirements as certified health information practitioners to keep up with continuing education credits. So another perk of having a student, I have taken a few students on throughout my work experience, and you also get those education credits that you are required to have to maintain our membership and our continuing education credits. So another perk of having a student, but it's wonderful to have and be a preceptor and have a fresh set of eyes and a new take on a new graduate. So it's beneficial, absolutely, for both parties involved in the practicum.
That's wonderful. Yeah, I know we've got our first cohort of students that will be going out on practicum this year. And that's always very exciting to see that first group going out. And I know that they're they're getting they're getting excited, but they're nervous as well. Do you have any advice for students as they're preparing now for their practicum?
Well, it's a wonderful opportunity to utilize that knowledge that you have from our course. Don't be afraid to ask questions. Build those relationships with your preceptor and coworkers. Ask questions, make notes. Take out as much as you can Knowledge wise, be a sponge and take in as much as you can, because it will all come back to benefit you in the workplace when you do get a job, and help you pass that national exam as well.
Absolutely. Well, this has been great. Thank you so much, Kyla, for everything that you have talked about and brought to. You've made it so exciting to want to go into this field. And thank you for joining us for the information session. We hope that these questions and answers have given you a deeper understanding of our program. And if this field and its significance to the healthcare industry is important to you and something that you want to be part of, you can go to our website and contact our office as well. Thank you, Kyla, and
Thank you.
have a great day.
Thank you.